Yeah, Dr. Patel, if we can just sort of start by digging into this data a little bit. I understand this is data coming from more than half the states in the U.S. children affected with MIS-C, if we want to refer to it as that from now on, looking exactly at the characteristics and the sort of burdens children are presenting with symptoms and what exactly the methods of care have been. Could you lay out for us, I guess, essentially give us your headline breakdown of what exactly is the most pressing findings from this?
Yeah, absolutely, Kevin. I think probably the 5-minute elevator speech on this is that these are children, as you noted, and adolescents, and children, by that we mean all the way up to age 20, that are presenting to the hospital pretty profoundly ill in what we call shock. Not all of them, but a fair amount. About half of them present in shock and require intensive support. 80% of them end up in the intensive care unit. 20% of them end up being on life support. And most notably, a vast majority of these tend to be healthy children and adolescents, if you will. 70% have no underlying conditions in general. And so that, I think, is a big surprise to all of us, especially as you mentioned early on in the pandemic, starting with China and Italy to the UK to the US. We really didn't have that many reports of ill children. And then we started noticing this, as you described. So, yeah, those are the big take-home points. Otherwise, healthy children who tend to be, on average, 8 years and older. They tend to have cardiovascular involvement. Their heart is predominantly affected. They end up going to the ICU requiring very specific treatments. So a life-threatening illness, I would say.
Wow. And it's just deeply troubling. And I think it's something that kind of sort of squashes a silver lining that maybe some people, at least parents, were carrying in the idea that their children were mostly safe from the current circumstances, and their lives, at least to some extent, could be somewhat normal. But of course, it's very necessary to understand, just as we learned with COVID, what exactly the greater risks of infection look like, and the more severe cases look like. What does that patient population look like, and sort of defining that for us. Doc, could you walk us through that? What exactly else we're learning about a more at-risk child, if there is one, and which ones are at a greater risk of severity?
Yeah, I think that is, essentially the $1,000,000 question. I mean, certainly we're learning a lot with this virus, which is very important. We have to let the data take us where the data do, and so, and respond to it appropriately, which is what I think we are doing. Certainly early on, the data told us that children, for some reason, were not getting severe disease. I can't say that they weren't getting infected. I think that's, a tougher mark to assess. But certainly, hospitals weren't filled with young children and young adults. That much we can say. So now we do start seeing the syndrome, MIS. I think we have to see what the data tell us. And here the data are telling us that, this is a unique syndrome with some specific manifestations that are different from what we have seen in the vast proportion of adults getting COVID, acute COVID, and lung involvement with some varied other organ system involvement. Here, the syndrome is different in general terms. This is a little bit of a narrative. It doesn't apply to every case, but in general terms, the children are presenting several weeks after their likely SARS-CoV-2 infection. Most of the cases tend to cluster after the peak of the epidemic in the community of coronavirus infections. So I think that sort of hints at, what's happening under the hood in terms of what this syndrome is. Is this truly like a direct virus-mediated injury, or is this something else? So those are the kind of things we're learning about this. I do think we have a long way to go in fully understanding this, and we're doing this now and going forward. So it is something we need to study more, monitor more, track more, find better treatments for, and understanding some of the consequences, I would say.